So 7 keys to success in the MRCGP AKT. Number 2, plan ahead. Common question I get asked is, when's the best time for me to sit the AKT? Well, remember first of all that you cannot sit it until you're at least in ST2. But in terms of when to sit it in, you could sit it in ST2, you could sit it in ST3, but when within that period? The answer is when you're going to have time to prepare effectively. Now, when that is going to be different for each of you, because part of it depends on your rotations, depends on what else is going on in your life, when you're going to have time to actually prepare. If you've got a big important family event, for example, coming up and you're going to be involved in, I don't know, preparing for someone's wedding, it's probably not the best time to try to prepare for a really challenging exam. So in terms of how long you need, the Royal College examiners recommend an absolute minimum of 3 months preparation. And if you've got a busy rota, if you've got lots of other responsibilities outside of your work, then 4, 5, 6 or even longer months, more than 6 months might be better for you. You know your own circumstance, but an absolute minimum is recommended is 3 months. Why? Because it's a really large curriculum. To put it into perspective, if we put it into hours of study, if you want to cover the whole curriculum systematically once and allow time for a couple of full-time mocks, it's going to take you somewhere between 175 and 200 hours of study, depending on your own existing knowledge, and sort of how confident you already are in some of the topics covered. Something else to look at is what rotations are you going to be in when you think you'd like to sit the exam. For example, if you are in a busy rota like A&E, where you've got lots of nights, weekends, and by the end of the shift you feel exhausted, it might be really difficult to study. It's not impossible, but it's going to be a lot more challenging than if you've got a relatively less busy rota. Exposure to general practice is really, really helpful. So, sitting this exam when you're actually in GP, or at least have done 4 to 6 months of GP, it's going to greatly increase your familiarity with a lot of the topics compared to if you try to sit it early in ST2 and you haven't had any GP rotations yet, because some of you, your GP rotation might be at the end of ST2 and then all of ST3. Okay? And then allow enough time, because of the fact that sometimes life gets in the way, doesn't it? If you plan your revision plan to a T to just finish the day before the exam, and you haven't allowed for the time that sometimes you'll be too exhausted after a shift to do any work, or that sometimes someone in your family gets sick or you get sick and there's a few days where you can't really study, you might find that you actually go into the exam not feeling confident that you've covered the material. That's why you should aim to finish the bulk of your revision about 2 to 3 weeks before the exam, so that you've got a bit of leeway. And then if nothing does happen, well, you can use that last couple of weeks to revise the key topics, to do some timed mocks, go over all of your notes, and go over topics that you found challenging maybe a second or even a third time. Okay, so to recap, key number 2, plan ahead to give yourself enough time to cover the curriculum and to allow time to prepare effectively so you can be confident going in. If you found this helpful, do subscribe, and we're going to be going to tip number 3 tomorrow, which is cover the curriculum.